everyone, welcome to the Live Life podcast. I'm Layan. Today we are at the third edition of Forbes Middle East Healthcare Leaders Summit in Abu Dhabi, and I'm joined by Dr. Nicole Sirotin. Thanks for being with us.
You're so welcome. I'm very honored to be here. Thank you.
Thank you. And my first question is I want to know more about the innovations and the initiatives that you are working on at your institution to promote longevity.
Absolutely. So the Institute for Healthier Living Abu Dhabi is an organization that's really here to help solve some complex problems. I have worked in the healthcare industry for almost 20 years as a practicing physician. And really, at the heart of what we're doing is trying to help people to live healthier lives. So in my practice as a lifestyle medicine expert and as an internal medicine physician, I've really helped individuals think about how do they take their health and both prevent but also reverse chronic disease, and then helped hospitals build systems in that way. And so now with the Institute, we're thinking about how do we then take this to the next stage where we involve precision medicine, where we involve machine learning and artificial intelligence to be able to actually understand all of the data points we can get on a human body, say, this is the map of your health and you're here and you want to be here. So how do we help get you there? And then we want to be able to do that for the health system because as I spoke about during the summit, we have a systems problem where we have people and we have technology and we have the financial structure where the economics of this is not all incentivized in the same way. And so when you talk about longevity, this is actually a very exciting problem to have. How do we help people live healthier, longer lives? But how do we take a system that's not set up for that and be able to pull those theories and practices into the system right now? So what we're doing at the Institute is really working with the Abu Dhabi government and specifically with the Department of Health to try to help understand if this is the population in Abu Dhabi, and we know that these people here are at high risk. We know we have high rates of obesity, of diabetes, of heart disease. We know we diagnose heart disease 10 years earlier here than we do in North America. How do we find those patients earlier? So identify their high risk. And then what we are doing is actually putting people through a randomized clinical trial to be able to really prove a model of care that will help lower risk of disease and also help save the government money.
That's absolutely interesting. And, preventive care is also a hot topic nowadays in the healthcare industry. So what, in your opinion, what role does preventive care play when it comes to longevity? And how can actually people incorporate these practices into their daily life?
So I think this is an interesting question because prevention and longevity are not necessarily one and the same. And so that's an important point. When we think about longevity, we're really trying to understand what makes us age and how do we either slow that process down or reverse it in some cases. And this is slightly different from preventing disease. So when we think about where is there overlap, we have many ways in which right now we could prevent disease. For example, we can prevent 80% of heart disease right now. We could prevent up to 90% of diabetes with very clear lifestyle interventions. So why aren't we doing that? Why do we have all these patients with these chronic diseases? Because the system is not set up that way, right? And so I think part of the question is what is available right now that we can implement into the system? And these are lifestyle interventions. These are some aspects of care that aren't incentivized financially and aren't set up within our healthcare system currently. Then the second question is, how do we get ourselves ready for actually these longevity-based therapeutics that are coming? We have so many exciting therapies that are in study right now. If you're talking about gene therapy or, epigenetics or looking at actually regenerative medicine, there are so many theories that are still in experimental form. And so part of our challenge is how do we know when the evidence is ready? How do we know when we can pull it into clinical practice in a safe and an ethical way? And part of the way we're doing that is to work with organizations like the Healthy Longevity Medicine Society, which is really a very established organization looking at how do we help systems and governments and doctors and other practitioners understand where the science is at and how we can use it safely with patients now. So I have joined the Healthy Longevity Medicine Society as part of their council. And we're working really to put structures in place so that we can practice like any other medical specialty, where we have guidelines, where we have requirements for education for physicians and others, and to really put some standards in place so that we know what is longevity medicine and what is not longevity medicine.
That's interesting. And Dr. Nicole, there is a lot of things happening actually in the healthcare industry. And every now and then we hear about new breakthroughs when it comes to longevity. So from your point of view, what do you think are the most promising breakthroughs when it comes to longevity?
There are so many exciting technologies that we could talk about. And I think part of what's promising is actually how do we pull in those technologies and help you and me and our families and other people access them in a way that actually improves our health and we know is safe. There are, right now, if you look at the amount of information we have around, let's say, a way that we can use a continuous glucose monitor to help improve your health, right? So how can we help you manage your insulin response or your glucose response after you eat, which are two factors that are very important for your metabolic health. Yet the insurance won't pay for that for you outside of diabetics. And there's still some ways in which we have to understand how to use all of that data to help people on an individual level. So what I think is the most promising is actually this idea that we can put some structure in place to be able to filter all of these technologies coming out, whether it's repurposed drugs. We have drugs that are on the market right now, FDA approved for one purpose, that are now being studied for longevity purposes. That's very exciting because those have already been shown to be safe and effective in many, many humans. And really Nir Barzilai from Albert Einstein is leading a lot of those efforts. And I think that's one example. But there are also some new technologies coming out, specifically within the LLM models and the way in which individuals will actually have immense amounts of information in their own hands. Imagine that you can now with the new strawberry release, as we've all seen the hype about, we will all be able to have immense amounts of information. What we do with that information, how we apply it, and how we take that into someone's healthcare sphere is actually, to me, what is most exciting.
Absolutely. And it sounds very exciting. I really look forward to that, seeing how that comes. Thank you so much for being with us and for sharing all of these insights.
You're very welcome. Thank you for having me.
Thank you.